Have you ever wondered why some intramuscular injections hurt so much more than the others? I'm sure you've had intramuscular injections before and you've had this painful experience. Why some others you felt like there was a little pinch to your skin? Now, you've received intramuscular injections before. Some felt like a tiny pinch, whilst others felt like somebody was stabbing your muscle with a burning hot needle. Why do some intramuscular injections hurt far more than the others? In today's episode, we are going to answer some of this question for you. So the surprising answer is not just the needle. It's actually a combination of several factors, including tissue injury, medication properties, injection techniques, and even the way your muscles are positioned during the shot. So in this video, we'll break down the science behind IM injections, the pain they can cause, and reveal to you 5 evidence-based techniques that can make the injection significantly less painful. So let's dive into it. Now, before we begin, remember that some discomfort is normal with any IM injection. And the reason is that the needle must pass through the skin, go through the muscle tissue, and naturally, this causes some degree of trauma. But the amount of pain can vary dramatically depending on how the injection is performed. So let me explain why some of these things happen. There are 4 main causes of injection pain. Now, when an IM injection is given, pain comes from 4 primary mechanisms. The first one is mechanical tissue trauma. Now, the needle physically penetrates through the skin, it goes through the muscle, and causing microscopic injury to the tissue. So that is one of the number 1 reason why people experience pain when they have intramuscular injection. The second mechanism that inflicts pain when we have IM injection is tissue distension. By tissue distension, I mean as medication enters the muscles, it occupies a space and stretches the surrounding tissue. And if the medication is injected rapidly, pressure builds up very quickly, and this will also increase pain. The third mechanism why people experience severe pain during intramuscular injection or IM injection is what I call chemical irritation. Some medications are naturally irritating to the tissue. For example, penicillin, diclofenac, ceftriaxone, also called Rocephin. These drugs can cause burning and actually aching sensation even when the injection technique is perfect. The fourth mechanism which causes pain when you have intramuscular injection is what I call nerve fiber stimulation. Now, there are small nerve endings in the injection area can cause or they can become irritated or injured, producing sharp and lingering pain. So again, the small nerve endings in the injection area can become irritated or injured, and this can cause sharp and lingering pain. So the overall pain you feel is usually a combination of all these factors. Now, what techniques do nurses use? What techniques do nurses use so that you do not experience severe pain? There are 5 techniques that has been proven by a randomized controlled trial that if they are used appropriately, your sensation of pain reduces significantly. The first one is the injection site. In fact, not all injection sites are equal. Researchers have shown consistently that the ventrogluteal site that is located on the side of your hip, okay, we call it a ventrogluteal site, located on your hip, is generally less painful. The traditional dorsogluteal side, that is the outer quadrant of your buttocks, where usually you get an injection. The science are proving that if you do the side of your hip, the ventral gluteal side is less painful than the traditional dorsogluteal side. And the reason is that the ventral gluteal side has thinner fat layers, fewer major blood vessels, fewer large nerve nearby, and a greater distance from the bony structure. Now, in contrast to the dorsogluteal side, which is the side where we usually get our injection, that area actually is closer to the sciatic nerve and often contains thicker subcutaneous tissue. So when an injection is given, the chances that it will be deposited into the fatty tissue is greater than going into the muscle, therefore leading to greater irritation and discomfort. So if your nurse or whoever is going to inject you chooses the ventral gluteal side, which is the side here on the side of your hip, you would experience less pain. Another thing that can reduce pain significantly is the injection speed. The injection speed makes a difference whether it's injected very quickly or whether it's injected slowly. Makes a big difference. Just imagine inflating a balloon very quickly versus very slowly, all right? The same principle applies inside a tissue muscle. When the medication is injected too rapidly, tissues are suddenly stretched and pressure rises very quickly. This rapid distension can trigger pain receptors and increases discomfort. That is why many clinicians recommend injecting slowly, approximately 1 milliliter every 5 to 10 seconds. And that way, the medication goes slowly and it reduces pain. Another strategy that can reduce pain significantly is what we call the needle selection and technique. If the needle is too short, the medication may not reach the muscles, it may be deposited into the fatty tissue. And if medication are deposited into the fatty tissue, they irritate it more and causes more pain. And so the size of the needle also make a very, very, very big difference when you are injecting. There's something also we call the two needle technique, where one needle is used to draw the medication from the ampoule, and then you exchange it with a new needle for the injection. And the reason is that when medication is drawn, it's been shown that the medication can cause dullness of the needle tip slightly and also leave traces of medication on the outside of the needle. So when you use a fresh needle, what you are actually using is that the needle is very sharp and less tissue trauma and therefore less chemical irritation along the needle tract that will reduce the pain that you receive when you take IM injection. The last but not the least technique that can reduce significantly pain during IM injection is what we call the muscle relaxation technique. And now, tension, when a muscle is tense, is very painful, right? And so when the muscle contracts, pressure builds within the tissue and therefore making injection more uncomfortable. So by properly positioning your patient, you can relax the muscles. Or sometimes people will tap gently to the area temporarily to release the technique, or they will hold the muscle gently to relax the muscles before the injection is given. And that way, when the muscles relax, your pain reduces significantly. So what is the takeaway in all this thing? What is the takeaway in this video? If you want to reduce pain during intramuscular injection or IM injection, Remember these 5 evidence-based strategies. The first one, to choose the ventral gluteal side over the dorsal gluteal side whenever is possible. Number 2, apply gentle pressure or rhythmic tapping before injection to relax the muscle. Number 3, use the separate needle for drawing up and then a separate needle for injection. Number 4, inject the medication slowly. And number 5, position the patient in a position position the patient so that he or his muscle can relax, and this will reduce the pain for IM injection. So small changes in technique can make a surprise big difference in patient comfort. Now, if you found this video very, very helpful, don't forget to like, subscribe, and share this with anyone interested in healthcare, nursing, or medical science, or anyone who gives intramuscular injection. Thank you for watching, and we'll see you in our next video.